pre-conference day of the World Orphan Disease Congress. Welcome to you all, and I'm looking forward to meeting you all. My name is Sonat Handa. I am a member of the Jocelyn Board of Directors, as well as own a life science consulting company called Biovance Consulting. And I'm going to be the chair for this session. This session is from 1 to 2:40 today, and this is on R&D, research and development, followed by a break. In case you all want to get some water or something, water is over there, the restroom's outside. And we're going to follow a strict schedule of time. Every speaker has got 20 minutes, which includes time for questions. So if the speakers want the audience to ask questions, please try to time it. And finally, I will request the audience and everybody to please put your cell phones on mute so that no one is disturbed. Really appreciate that. So with that, we can begin, if you're all ready. All right, so the first session is actually a presentation on Stop, Collaborate, and Listen, Bridging Gaps to Accelerate Research in Huntington's Disease. We have Lauren Holder and Thomas Hart to take us through that.
Hi guys, thanks so much for being here today. Can you hear me okay? Yeah? Yeah, it's my first presentation of the day. Not nerve-wracking at all. I'm Lauren Holder, and here, I'm gonna go this first. I am a patient advocate first, producer and host of a podcast titled Help for HD Live, through a nonprofit organization called Help for HD International, and we support the community through many resources, but mine specifically is the podcast and providing not only educational resources and research updates and a bunch of stuff. We also do an HD Uncut series for the community to come on and share their journey. And so it's uncut, uncensored. They can share whatever they want to. We've had people share poems, all kinds of stuff. And you know, the reason I do that is because I am gene positive for Huntington's disease. I was my father's caregiver, and I am now going through the journey myself with HD. I'm considered the prodromal stage of HD, so very early HD. And I'm gonna have Thom come up and introduce himself really quick.
Sure thing. Hello everybody, my name is Thom Hart. I'm the Director of Outreach at the Critical Path Institute. CPATH, as it's called, was created about 20 years ago through the FDA. We're a nonprofit organization that's, our mission is to accelerate the drug development process. We're a neutral convener that works with industry, regulatory partners around the globe, and community advocates. My role is to work in rare neurodegenerative diseases to bring that patient voice to the process, to live up to the ethos of the FDA's patient-focused drug development guidance. I'm heavily caffeinated because we're in Boston, Duncan, you know. So apologies for that. I'll try and not talk too quickly, but we only have 20 minutes, so I want to get everything in. Anyway, so thank you.
Thanks. So we'll just go over a brief agenda. We're going to do, obviously, intro, what is Huntington's disease, collaboration with the HD community, outside of HD, and the value of community involvement. So before we get started on the big stuff, what is Huntington's disease? A lot of times it's described as having ALS, Parkinson's, and Alzheimer's all at the same time. It is very similar to ALS, but we have a longer period of time of suffering. And that's really the biggest thing there. And we're 100% genetic. So it's a genetic neurodegenerative disorder that causes progressive damage to nerve cells in the brain, leading to a decline in physical, mental, and emotional abilities. It's caused by a mutation in the HTT gene, which leads to the production of an abnormal form of the Huntington protein. The progressive neurological damage results in a complex array of symptoms affecting movement, cognition, and behavior. It's inherited in an autosomal dominant pattern, meaning a child of an affected parent has a 50% chance of inheriting the mutation, which I did inherit from my father. I was really excited to get this opportunity to speak because in the past few years in our community, we've had a lot of changes that needed to happen. I feel like we were at a point where we were not moving where we needed to. In research, for sure, we don't have somebody dedicated to fight for us when it comes to legislation or anything like that. We were not really part of a rare disease community. We were pretty much by ourselves with our organizations, and we were not doing well. And a group of us decided that we really needed to make some changes. We needed to start speaking to all of the stakeholders involved in HD. And those conversations really have built this amazing opportunity, and we've seen a shift in our community, and it's really cool to see this shift in the dynamic. One of the biggest things is we've learned from research that HD is one of the movements. It comes on very early, decades before movements. So the cognitive symptoms and behavioral symptoms are there, decades before, and they can see those changes in the brain. Because of that research and because of what they know, our clinical trials have started moving earlier into the disease process, or trying to move earlier into the disease process. Obviously, we've had issues because of FDA and trying to get things approved, changes in clinical outcome measures, things like that, that need to be changed and still need to be changed. It's a work in progress, but we all realize now as a collective group that it is a problem and we need to find a solution together. And so it's been really nice. One of those groups that has really been instrumental in that is a group called the HD Community Advisory Board. It's a global initiative, a partnership between 3 different global HD organizations to bring together industry and the community. And we all have a seat at the table. We do advisory board meetings, we do education, and we basically find solutions to issues together. And it's been phenomenal. It's one of my favorite things to participate in, is this advisory board. Not only because of the diverse perspectives that you get in all different stages of the disease, but just because you really feel like you're part of it, and it's empowering to feel like you're part of the solution and not just a lab rat. So that's been a huge thing for our community, and we're seeing a big increase in this interest of people participating, getting more and more people to participate in these advisory board meetings and community advisory board. Another group that's fairly new, and actually my counterpart to this is over in the other room speaking this morning or this afternoon, HD PACE. So a group of us in the HD community came together, saw that there were gaps in the community that unfortunately none of the organizations right now were able to meet, and we were trying to figure out as seasoned patient advocates how we could help. And with our connections, with our voices, or just how we are, we basically got a whole group of us together, just independent advocates, to start talking with all stakeholders. We had a think tank meeting to figure out what barriers there are and how we can provide action items to overcome the barriers and gaps. And it's been amazing to see the collaboration within that. We're not a nonprofit. We're not trying to replace our nonprofit organizations. We love our patient advocacy groups, but we also want to help in whatever way we can. And so we do that on an independent level in finding those gaps and trying to figure out how we can overcome stuff. Because of these things, we've seen community engagement on a much higher level, and this collaboration between patient advocacy groups that we didn't see before. And so a lot of us now are really aligned. And it's really cool to see that, because a lot of times, you see different organizations competing, which it shouldn't be that way. It should be we're all working towards the same cause. And we're finally at a point where we're seeing so much collaboration. We're all attending each other's events and speaking to each other and having very meaningful meetings, and it's really wonderful to have that. The other thing that has been really great, now this is an error here, but I do want to bring up beyond the HD community. we have started talking outside of the HD community. So things like this, we have broadened to other disease groups, rare disease groups, and want to get feedback because we don't want to reinvent the wheel. We don't want to take from them, but we can learn from them. And so we, in our think tank meetings, have actually had, seasoned advocates from other disease groups come in to share their perspective in things that they've already done. And we're maybe starting with it and get their advice on how to go through it. And I find that when we work together like that, it makes us stronger, and we're able to advocate for each other on a much larger level. So it's really wonderful to go outside of our disease group and start pairing and collaborating, partnering with these other disease groups. And I'm gonna stop talking now and let Thom talk a little bit.
Sure. Awesome. So let's talk a little bit about engagement. So these are some, I think we all sort of understand this piece, but this is the, we boiled down the essentials of what that patient engagement model can look like. And one is that patients can shape research. They can help to inform biomarkers and endpoints. They can talk about the trade-off between quality of life and advancing research. They have unique expertise, which is critically important to researchers and industry so that they can understand that pathology and the diagnostic odyssey, the journey of the disease. And they're able to align priorities in research with real life and lived experience, right? There's many, many examples of this, but I've sat at the table with researchers that are trying to decide whether or not these really invasive trial designs are worthwhile. Will we get enough patients to participate? And I sort of raised my hand, like, have we asked? Like, let's ask the community. But you need an engaged community in order to ask that question, right? It's sort of one that you can't put the cart before the horse. So these are some of those sort of basic principles that we talked about, but what's so exciting is, we're gonna come back to this slide in just a second more.
Okay.
When you get through that work, we start to see that other diseases in their advocacy have already trod this path. And so you find a historical perspective where other patient organizations who have been through the drug development process are able to teach you learned lessons. We can talk about what HD has learned from the ALS community and what the ALS community, through their Sandy Moore's principles, have learned from HIV advocates a generation before that, right? These principles about elevating the voice of patients and lived experience to inform the drug development process, they're true regardless of the disease. And so we can learn from each other as patient advocates and build a faster, better process. Then we get to collaboration. This is where the patient-focused drug development process, I'm sorry, I took my watch because we have to keep on time. And I will quickly just note that this happens not in a vacuum, but very much with the sort of messy process of having these open meetings, taking questions, things that sometimes make researchers' hair stand on end. But just get yourself a chatty lawyer and you'll get through it, I promise. This is the value, right? There is return on that investment. You'll have an enhanced clinical trial design, improved recruitment and retention, more meaningful outcomes, more regulatory success, everybody wants that, and better market uptake. And perhaps the greatest value is that I can tell you that all these things are real because here you go. Here are rare diseases. Here are the real world examples that show that these things work, right? This process is effective. It's proven time and time again that if you build a meaningful patient-focused drug development tool, it will give you these kinds of outcomes. Which is, I think, really cool, maybe not revelatory anymore, but very exciting stuff. And this is what HD gets to take as its standard and move forward. And that's part of what is so exciting about this work.
Yeah, absolutely. And Critical Path Institute has really been instrumental. I remember when I was telling Thom this earlier, we had a patient advocate who said that I was having regular discussions with Critical Path Institute, and with Thom, and they were like, oh, you know, my perspective is really that it's not gonna be very helpful. And we keep up regular meetings because of this, right? Because they wanna help, and we have action items, and we move things forward, we keep that momentum going. And it is because of that, it is because of Critical Path Institute and HD community coming together and working together that things have moved forward, and we've seen that shift in the HD community. And so it's funny because now when I talk to that patient advocate, they're like, oh man, yeah, I see what has been done through this collaboration. So it's really, really cool to see. And then I'm just gonna go back to that slide really quick.
There you go.
So I just want to leave you with this for me, but when every voice has a seat at the table, which for me, having a seat at the table is extremely important, the puzzle starts to come together, and what once felt like barriers become stepping stones towards breakthroughs. So, do you have anything else?
I will just quickly share. We're going to keep this slide.
Okay.
I will just add, CPATH has a specific research consortia called Critical Path for Huntington's Disease Research.
HD risk.
HD risk, yes.
I'll go with the short version.
Yeah, and through that mechanism, we've been able to bring many of the patient advocacy organizations together with global regulatory bodies, FDA, EMA, Health Canada, you name it, and industry partners as they become interested and want to participate in our discussions. That allows this neutral space where regulators can be in the same room as industry and patient advocates and listen to the discussion and be able to take notice of it. It's a really exciting time to be able to sit at that table. And there are 39 other consortia at CPATH, and I will shamelessly plug this. In September, we're having our Global Impact Conference in DC. If you want to learn more, you can email me. But it's such a cool opportunity in this space at this time where we're seeing this kind of patient voice be included and elevated to be part of the research on the work that's being done. And I just want to thank Lauren. She has taught me a lot as an advocate, and also as we're sort of building this model together. And we have time for questions for 6 minutes.